A scathing new study found lockdowns did little to stop the spread of COVID, and those who've criticized heavy-handed pandemic policies have been eager to highlight the report. The analysis from Johns Hopkins University looked at data from 24 studies of pandemic restrictions and COVID mortality rates. Researchers discovered that, quote, lockdowns have had little to no public health effects, and that the restrictions, quote, imposed enormous economic and social costs where they have been adopted. Some Republicans touted the study as evidence that policies favored by Democrats have been failures.
But now we have lockdowns which are not based in science, and really we know that by and large, masks didn't work, plexiglass didn't work, 6 feet of distance didn't work. The one thing we do know that did work is vaccines and natural immunity. Those work to protect people from hospitalization and death and also slow some of the spread.
The White House defended President Biden's pandemic record in light of the study's findings, arguing Biden himself has not called for a lockdown since taking office.
I would note that the president has been clear we're not pushing lockdowns. We've not been pro-lockdown. That has not been his agenda. Most of the lockdowns actually happened under the previous president.
As polls show Americans are tiring of pandemic-era rules like mask mandates and school closures, the Biden administration has worked to distance itself from the most unpopular restrictions. It comes as even liberal leaders are calling on the Biden administration to start treating the virus like an endemic illness and move away from its emergency management approach. Sarah Westwood for the Washington Examiner.